segue into it, why don't you just introduce yourself to the audience and share a little about your background and growing up and all that?
Sure. So my name is Anjana Sreedhar. My pronouns are she, her, hers. And a little bit about me, my day job is that I currently work in strategy and operations at a cancer center at a major academic medical center in New York City. And by night, I guess you can say, I love to read, write, breathe all things health equity, which has manifested in the book that you were just talking about titled Healthcare of a Thousand Slights, which I like to summarize as a history of health disparities among marginalized communities in the United States. So the thesis of the book is really seeking to answer the question, how did we get here? How did we
Mm,
get to a place where our health disparities and health outcomes are so different depending on the color of your skin, how much money you make, and all the other different identity markers that one can think of. But prior to that, I was an administrative fellow at a major academic medical center in New York City. And prior to that, I was in grad school, did my MPA in health policy and management from NYU's Wagner School of Public Service. And prior to that, I worked for 2 years in healthcare best practice research and marketing for a company known as Advisory Board. And prior to that, I was in undergrad. And it's funny that my journey has kind of brought me to healthcare in a very circuitous way because
mm.
I studied international relations and minored in Chinese in
Oh,
undergrad,
wow.
thinking I wanted to work in like global diplomacy and
Interesting.
Security Council level, nuclear disarmament, like that kind of stuff.
Wow.
But yeah, so it's like such a right turn away from that. But my senior year of college was really when the repeal and replace movement started to become a really big deal in
Mm,
domestic healthcare policy in the United States,
mm.
and that really got me thinking about the state of American healthcare and all of these headlines that we used to see during that time, which is America is considered the most prosperous, wealthiest country in the world, but somehow can't get its healthcare systems together in a way that the American people are deserving of. And so that kind of took me down the healthcare road, and that's how I ended up where I am now.
I absolutely love that. Very succinct. And yeah, it's interesting from 2010 when the
Hmm.
Patient Protection and Affordable Care Act, was implemented all the way up to 2016, which would have been, I think, your senior year, my senior year as well in undergrad.
Hmm.
Um, yeah, it's a very interesting time. And I think that by the time that I kind of came to consciousness about like health policy, I was just
Yeah,
like, okay, there's no way that they're going to, be able to do this, like repeal anything. It's, served so many Americans already. And so it's just
yeah.
interesting to meet like another, kind of another young professional who uses that kind of as like, motivation or the inspiration to really start looking a little bit deeper because it was the Affordable Care Act that also kind of led me to be interested more so in healthcare. But I want to go back even further.
Let's
Um,
do it.
what was life like for you growing up?
Yeah, no, that's such a great question. So for me, I identify as an immigrant slash like the 1.5 generation, which basically means you moved to the United States when you were a kid, but you
Ah,
effectively have spent most of your life in the United States. So I moved to the US from a country called Seychelles, which is off the coast of Madagascar, in the Arabian Sea. My parents are from India. My dad got a job there, so that's why we were living there. And then he got a job opportunity in New York. And so we moved to Queens first. And so it was really interesting being an immigrant who came from a very interesting background in the sense that the Seychelles is an island. It's a very much an island country in terms of how people like to spend their free time and what
mm,
the economy is very tourism driven, all of that kind of stuff. And then coming to the United States where you're meeting people from literally, at least in Queens, you're meeting people from
yes.
literally all around the world.
Hmm.
And so I really appreciate that I had the chance to grow up in such a diverse environment because even though I was weird and different, so was everyone else. And so that was really helpful for me to understand, okay, this is what America is all about. It's all about people
Mm,
coming from all over the world to make their home in this country called the United States.
yeah.
And then we moved to New Jersey, where again, we found a very diverse town to move to. So a lot of my classmates look like you and me.
Hmm.
So I was just very used to being in environments with a lot of diversity. And it wasn't until after college when I, moved
Mm,
to DC and I recognized that there are parts of DC that are very diverse, but
right.
unfortunately, DC, like many other cities, is experiencing rapid gentrification and a lot of racial segregation. Previously, that was, policy mandated segregation,
Yeah.
and now less so. But in any case, that's when I first came to face with the fact, like, oh, I am a member of a minority racial slash ethnic group in the
Mm,
United States. Like, not everybody looks like me or can relate to my experiences.
yeah.
And that kind of got me thinking a bit more about identity politics, diversity, equity, things of that nature. And then, of course, combined with healthcare, that's what kind of led me down the road that I'm on now.
I really love that, and it's very interesting because I definitely feel like I had a being from Philly, not as big as New York, of course, but being from Philly, once I left, I realized that I had actually a superiority complex about myself because, my version and vision of America was like the true melting pot,
Right.
really not ever, I encountered stereotypes as a kid because I lived through different socioeconomic backgrounds and areas throughout my life. But for the most
Hmm.
part, like, it was pretty much people of color really ran the town, and I
Yeah.
didn't really notice, many disparities. And it wasn't until like me really leaving the entire East Coast region, coming to the South, really understanding like, okay, my version of America is not the same as everyone else's version of America. And one of the things that I was
Mm.
impressed about with Healthcare of a Thousand Sites is, as a New Yorker, if you consider yourself a New Yorker, I'm assuming that's maybe a part of your identity as well.
Yeah.
You really have an ability to really like kind of be able to speak to the entire country. I think to a lot of different people's experiences. So I would actually love for you to kind of just talk about how was it kind of carrying this identity, having the background, having the childhood that you did, knowing that,
Hmm.
hey, like you can be different and we can all come together and work. How did you kind of initially deal with this reality that, oh, or this realization like, oh, wow, I am a part of a minority community, quote unquote, or I am a woman of color, and there may be things that happen to me, or, my outcomes may be impacted solely by this. How did you process and navigate that, particularly as a professional?
Yeah, no, I think that's a great question. I think for me, first of all, it's a very sobering realization when it happens, right? It's one thing to read about these things as theoretical concepts that just exist in a textbook or
Mhm.
in a magazine article or something, but then to actually think about, like, oh no, like these things are actually having an impact on me, on my family, on my community, on my friends, right? So I think for me, that kind of has driven me even more to want to focus on health equity, because it's made me realize, like, this is not just theoretical. This actually
Mm,
affects real people, and I am a real person, and the people that I
yes.
associate with and I'm in community with are also real people, right? And so I think that's kind of really shaped my mission, vision, values, so to speak, around really centering, like, what does it mean to center patient care, right? Like, I think we hear that phrase all the time. We've heard it in graduate school, we've heard it in any employer that is a healthcare employer says it, but what does that actually mean? So
Right.
what it actually means is, when you center the patient experience, you really need to be thinking about the entire patient that's coming
Mm,
to receive care, right? Like, they're not just coming as a sick person, they're coming with all of the other baggage of the day or of their
right.
lives. And obviously for clinical professionals, it's a lot to handle in a 15-minute, 20-minute visit. Like, how do I fully accept this person and everything that they're going through, along with the fact that they're not feeling well, make them feel welcome and understood, but also ensure that they have the resources that are necessary to improve their outcomes after the visit, right?
Mhm.
So for me, it's been thinking about, like, okay, here are these very theoretical, high level workflow operational concepts, and then there's people's lived experiences, and both are equally valid and equally important. So you can take
Mm,
best practices that you learn from, a case study or from the way that a certain organization runs, and that's all valid and good, but those workflows and practices don't mean anything if the organization doesn't actually account for the person's lived experience and what they're going through. So
wow.
there needs to be a way in healthcare to bring those two pieces together. And I actually learned this from, I moderated a conversation about women's health last week, or a few weeks ago, and one of the speakers was Dr. Neil Shah, who's the chief medical officer of Maven Clinic, which is a fertility provider for lots of employers. And he actually really made this point from a provider perspective. We have all of these
Mm,
best practices in place, but it doesn't mean anything if you don't equally validate one's lived experience. So I'm going to
Yeah.
give that credit where it's due. I think that really got me thinking about, like, okay, yes, these are the things that I care about when I think about my own lived experience as a patient, but also the ways in which that intersects, lived experience intersects with, healthcare as an industry.
Oh wow, that's I could have just I gotta give you some snaps there. No, seriously, because you are preaching. Because the reality is, one of the things that I observed just throughout my healthcare journey, and just I think in
Hmm.
any industry, particularly when it's
Yeah.
a more corporate environment, is assimilation and conformity is a thing.
Yeah.
And a lot of times, it's standardization. Let's get our processes and our workflows up. Let's be efficient. Let's get the patient in, wheels out. Let's make the revenue. Let's grow the business. Great. And like that's kind of I feel like sometimes when you want to be a good healthcare provider, administrator, that's kind of how a lot of people think. And one of the things
Yeah.
that you said that I think is important is for people to just like understand and accept that like you're a real person. People are real people. History is real. Current events are real. All of the context that may contribute to somebody's health when they show up to our doors is very real. And I think
Yeah.
sometimes because of just how paced the environment is, we kind of all like to put out fires in many ways. We
Hmm.
can kind of forget that, like, hey, like this is more than just, a number on a spreadsheet. And I think it's important for us to really be able to like call out our humanity. Like that takes,
Hmm.
a lot of courage. And I think not to just like go super deep here, but one of the
Let's
things
do it.
that you one of the things you touch on in Healthcare of a Thousand Sites is the model minority myth.
Yeah.
And with me talking with a lot of my colleagues, a part of the Asian American community or South Asian community, is, there may not be as much implicit space for you all to really say, well, like, hey, this is my experience, this is my identity, because there is this myth about, this particular group of people of color.
Yeah.
And so can you talk about just like your journey, how you kind of generated your power or became empowered really to say like this is who I am, this is what I have been through, this is what maybe people who look like me or share my background have gone through, and really taking that in to the
Hmm.
workspace and just finding your voice in that regard.
Yeah, no, I think just going just back to specifically the model minority myth piece, what's interesting is I think for a long time, a lot of Asian Americans, myself included, like when we were younger, at least when I was younger, definitely wore it as like a chip on my shoulder, right? Like,
Mm.
oh wow, like we're special, we're chosen.
Wow.
And that makes us, unfortunately, this was my mindset for a while growing up. This makes us better than other
Mhm.
communities, right? And what I realized over time is the reason that that mindset developed was because I was not able to or not allowed to access the history behind why that myth was created.
Wow.
So once you identify that, what we learn about in school, we learn about the Chinese Exclusion Act and the Gentleman's Agreement and how, South Asian Americans were treated when they first came to the United States and all of that. But what you don't learn about is how all of these different racial groups came together to support civil rights. And
Mm.
obviously, led by the Black community, but with the support of other communities. And there's a lot of like, a lot of history around groups like the Rainbow Coalition. Like you have all of these
Yes.
different racial groups coming together to say, we demand better for our children, for our community, for our people. But that's not history that we often are able to access in our growing years. And so I think for me, learning about that history in college, and again, because I sought it out, it's not something that came to me
Mm.
organically or naturally through like what I was supposed to be reading. That helped really empower me to say, okay, I can be a leader in the health equity space, in the diversity space, um, because my people, even if it's not my direct lineage, people who look like me have stood on the right side of history and have supported civil rights and have supported the need for equal housing and better healthcare and better education and all of those things. So knowing that that's the reality, that really has helped me step into where I am now in the workplace, where I can say like, these are real issues. Implicit bias is a real issue. Racial discrimination is a real
Right.
issue. All of the isms that exist in the world are real
Yes.
issues. But I was only able to get to that point in my life because I felt empowered by the education that I had about
Wow.
how all of these communities came together and how people who look like me were doing these kinds of things already.
I love that. I love that. And I apologize if my Zoom is having issues. I
Yeah,
don't know
you're
if I look
frozen, but I can
frozen.
hear you. Yeah, you're
That's
frozen, but I
perfect.
can hear you.
Yeah, I should have updated my Mac earlier
You're good.
today,
You're
but
good.
it's perfectly fine. It's about you. You're the important one here. Um yeah, so I love, first of all, I appreciate you being very honest about kind of just, your thoughts about the model minority myth when you were younger. And I think, to that point, I mean, in the United States, a lot of times it is about survival and
Right.
mobility and
Right.
what can you leverage in the moment to get you kind of to the next step, right? And I think that it is something that a lot of people still go through. Not everybody can be as brilliant to kind of maybe have the breakthroughs that you did at such a young point in your career. But I think it is really important to just like be that transparent about something like that, because one of the things that actually was discussed in another podcast episode a few seasons ago was that Asian Americans are over indexed on the clinical side of healthcare, but
Yep.
really underrepresented in terms of administration. And
Right.
so even as we start to see, leadership change and just representation evolve across the industry, like your story and these kinds of conversations are just that important, because to your point, like a lot of times they're not talked about. You don't have access to the actual history. And you actually made
Hmm.
me think about the first time that I heard about the Chinese Exclusion Act, which was also really in college. I had some familiarity in high school, but I really didn't do a deep dive until I got into undergrad. And it was the
Yeah.
first time that I realized, like, oh, okay. So it wasn't just Black people or, American indigenous communities that were
Right.
systemically, really disrupted. It really has been just about any in every non-white male group, Christian group that has, come to the country. So that is absolutely fascinating. So speaking of that history,
Yeah.
what what was the inspiration behind Healthcare of a Thousand Sites? Because it is an incredible read. It is absolutely thorough. And as I said before we really, got into the conversation, I could only dream about writing something like this. So what was really the inspiration, the motivation behind it? And maybe can you talk about just the process as well?
Yeah, sure. So for me, I've always been really passionate about history and knowing our history. And I think for me, like I think different history buffs have different periods of time that they're really invested in. And for me, it was like post World War II
Mm,
history, because that's when you really started to see the rise of America as an economic superpower, but obviously under the veneer of, who are the people who are allowed to rise into the middle class? What do they look like? Who is allowed
yes.
to access the resources that allowed America to become the economic superpower that it became in throughout the 20th century. So I've always been really passionate about history, and I've always been really passionate about healthcare. And for
Mm,
me, I wanted to find a way to kind of put those two things together. And I was already kind of noodling on this idea of, what is the history of healthcare in the
wow.
US? Again, trying to answer that question of like, how did we get here? How do we get to this weird place in American history where all of these decisions were made and ultimately we have this healthcare system that really doesn't serve anyone.
Hmm.
So I was thinking along those lines, and then the COVID-19 started, and this was before it came to the United States. But obviously, in the increasingly globalized world we live in, I was thinking it's only a matter of time before it gets here.
Hmm.
And when it gets here, who's going to have the resources to protect themselves from it, and who isn't? So I was already starting to think along those lines, and like, where is history going to repeat itself as far as
Oh, wow.
when pandemics have come, or when there's even not it doesn't even have to be as dramatic as a pandemic, right? Even things like economic downfall, right? The
Hmm.
Great Depression, the 2008 financial crisis, like who is
Absolutely.
affected and who is insulated. So I was already thinking along those lines a little bit. And then I was already posting a lot about healthcare on LinkedIn. And this really wonderful professor from Georgetown reached out to me and said, you write really good content on LinkedIn. Would you be interested in joining my book writing program?
Wow.
And I was like, this is a scam. There's no way, right? This isn't real. But having lived in DC, I had friends who, went to Georgetown or like did graduate school at Georgetown, and they were like, "No, this dude's legit." And I also like looked into him a little bit more. For those who are interested, his name is Eric Custer. He is fantastic. He's incredibly supportive. So when I decided that I wanted to work with him, we kind of sketched out what my idea was, and I kind of like basically what I outlined to you, but much less coherent was what my conversation with him looked like. And he kind of helped me figure out how I'd want to structure the story and how I'd want to, categorize things and how I'd want to start and end. And so his book writing program was really like, how do you write a compelling story, regardless of whether it's fiction or nonfiction? And how do you write it for an audience that may not be an expert in that space? And for me, like, I appreciate you saying that all healthcare professionals should read this, but I was really targeting like the average person who may not be steeped in healthcare, or in history for that matter, right? So I wanted to make this a really approachable, a comprehensive but still approachable read about
Okay.
how we got to answering the question of how we got here. And so I worked with this professor, and then he has a partnership with a small publishing company. They used to be called New Degree Press; they're now called Manuscripts.
Okay.
And they read some of my work, my initial manuscript, and then I got greenlit, and then the rest was history. And it was a lot of writing drafts, getting edits back, making sure that the work needed to be where it was, and then obviously working with marketing and
Hmm.
promotions to like pick a cover and promote the book in other forums and things like that. And that eventually led to me getting published and the book getting printed in December of 2020.
That is absolutely amazing. So, okay, just as a so from a timeline perspective,
Hmm.
were you in your administrative fellowship already? Like, was this
Oh my God, no.
simultaneously or okay,
No, I was in grad school, and I think I will
okay.
say that, like, for others who are interested in writing takes a very long time. For a lot of people, it takes years to write a book. For me, I was able to do all of this within the span of 1 year, but with a very important caveat, which was that I was in my second semester of grad school. I had already lined up my administrative fellowship, and I was taking
Mm.
one class, and I had a part-time job that was very chill. So I had a lot of time.
Okay.
Um, so I was, I treated right, and I had, again, going back to what we were talking about before, I had the privilege, right?
Mm.
I was able to quarantine at home. I was able to quarantine with my family. I didn't have to pay rent. I didn't have to worry about groceries and all the other basic necessities of living. So I was able to focus my time on, okay, this is an important project to me. I'm going to treat it like a full-time job. I'm going to write 8 hours a day, interview people, do research, watch documentaries, do what I need to do, but I'm going to treat this like a job. And for a lot of people who are writing, a lot of people who write are not full time writers. They're doing it on the
Yeah.
side, and so obviously that means that it takes a lot more
I keep freezing, Jesus. This is okay. So I think that still speaks to how amazing even with all the time that you have, I don't think people that that's still underselling yourself a bit short.
time.
Because again, like, it makes sense why I actually really thoroughly enjoyed it. In terms of you writing it for just like kind of the, every, day person.
Yeah,
Because like, for me, as you kind of uncover and like unpack like each chapter, it's like, okay, these are things that really I didn't start learning more about until I got into healthcare. Like,
right,
I may have seen like a Vox video here, about
right.
something. I may be familiar, relatively familiar, but I think that one of the things that really impresses me again is that you really kind of like cover all of the identities that I think like at the core of I don't want to say like the left or like liberal like America right
Hmm.
now, but reality it's like it's what makes up the country right now. Like when we think about women, when we think about our Latinx or Hispanic communities, when we think about the LGBTQIA plus community, I just
Right.
think that there's a lot of different things that you cover that make it so thorough. So I want to ask you this:
Yeah.
you doing this before you got accepted into administrative fellowship, your mentality in terms of like what you were exposed to throughout the fellowship, were you let down? Did you know like what you were gonna, because for me I'm like, wow, like she, to do this before the fellowship and then get into healthcare where you literally are essentially a junior executive, you're at a major medical center, a major institution with global brand recognition. What was
Hmm.
just kind of like the reality, now that you had this lens, healthcare of 1,000 sites or through 1,000 sites? Um, how did your mind kind of process everything that you were experiencing during your fellowship?
Yeah, no, I think that's a great question, because I think the way that fellowships are set up is that they are often, not always, but they're often at large academic medical centers with a lot of resources, usually located in large metropolitan areas, right?
Mhm.
And so that's obviously reflective of the patients that are able to afford to come.
Ah, yes.
And so I think that to me was really important to keep in mind, especially working in Manhattan, where the patient population, for the most part, not always, but for the most part, is more affluent.
Mhm.
In terms of, we throw around the term payer mix a lot. In terms of payer mix, mostly privately insured patients. And so obviously that has an impact on the kind of revenue we're able to generate, the kind of infrastructure we're able to support as far as data and things like that. So I'm happy to say that I learned a lot because I had access to a lot of resources, but
Mm,
I was mindful of why.
mm,
And the reason was because of all of the things that I've just mentioned, right?
yeah,
Whereas if you are somebody who is doing an administrative fellowship or is serving in administration at a truly community-based health center, you are serving the patients that have the most need, but you
mhm,
may not always have the most resources to do so.
right.
And I understand that's how capitalism works, but it's like it's an interesting insight into how our healthcare system is structured. It obviously, capitalism affects how every institution is structured,
Right.
every industry is structured, but it's interesting to see how this particular insight applies to healthcare in particular. So from
Mhm,
like a learning perspective, I was able to learn a lot, and I think the organization that I did my administrative fellowship at was very progressive in terms of like how quickly they moved to make decisions, because the running joke is like large institutions are very bureaucratic. You need to
right.
get like through 10 layers of red tape, or 12 people need to see this PowerPoint before it can move forward.
Mm,
But I think, I was able to learn about, going back to what you were saying earlier, healthcare can be still a very fast paced
mhm,
environment despite all of those challenges. So I was able to, learn a lot, get access to a lot of really important mentors and leaders and people who are really thinking about centering the patient. And so I'm always going to be grateful for that experience. But on the flip side, I'm also very aware of the reality of, each institution is able to support, if support patient care or support clinical research or support medical education for residents and trainees based on the where they're located and what their pair mix looks like.
yeah. Wow, you're actually challenging some notions that I have. And, it's all I'm also thinking in my head like, your organization was just so much better than mine. A little bit more progressive and further along. And I love where I did my fellowship at, so I'm not, beating it
Yeah,
up at all. Um, But for me, I guess I was a bit disillusioned. I started and came into my fellowship with my MPH, and I was coming from Atlanta. And so I transitioned from Atlanta to the Midwest. And,
mm,
I was not dealing with, I would interact with people who, really weren't familiar with the term health disparity, for example, right? We're in St. Louis, and, I would ask leaders, about the history of St. Louis. Why, are we still so segregated, not only,
mm,
geographically, economically, but also
yeah,
culturally, like what's going on? And certain people really hadn't, they didn't know about Jim Crow, or that time period. And I
mm,
was just like, what is going on? It was, I had
yeah,
a lot of dark moments where I was just like, oh, did I pick the right industry? And I had
yeah,
actually, I'm going to ask you this question because I'd be curious about just your response.
yeah,
So I went through this my first year. I was like, man, I shouldn't be an administrator. This is all, driven by capital. As you said, payer mix literally is the excuse thrown around when we don't want to invest in more marginalized communities.
right,
Um, and so I had this whole kind of dilemma of, should I be inside of the system or outside of the system? And I just guest lectured to a class, a health planning or health program planning, implementation, and evaluation class at one of the local schools in St. Louis, and it
nice,
was all MD MPHs. Um, and they were just like, and one of them asked me, like, yeah, like, do you feel like you would have a person like you, a little bit more radical, I guess, in certain contexts? Do you feel like you have more impact, on the inside or the outside? And my response was both. I think you need to have,
mm,
connections to both the community and more grassroots, efforts, but also leverage the capital, leverage the resources, leverage the power that you literally get from
yeah,
being a part of major institutions. So what would be your response to that? If a future physician or administrator asks, where should we really focus our energy, on the inside trying to disrupt the system, or on the outside trying to generate power for some of these communities?
Yeah, no, that's a good question. I think for me, I would probably answer very similarly to you because I think like you and I are examples of doing both, right? Like we have our day jobs where we work within the context of large healthcare institutions, but what we've realized is, that may not be necessarily all we want to do. We want to have an impact out in the community, and that's why we're doing things like podcasting, writing books, creating collectives, things like that. So I think there is a way to do both. I will say to your point, I think when you're inside the system, it may feel very hopeless, which I've also definitely felt of like, is anything ever going to change? And to me, it kind of made me think about the relationship between policy and implementation. So, we're kind of dictated by, to a certain degree, we're dictated by what the state capital tells us that we can do, or the city council tells us we can do, right? Or even in DC, if they change Medicare reimbursement, like that's automatically going to affect us, right? So there's a lot that's not within our control, even when you're inside some of these very powerful institutions, because they still have to listen to what policy is being dictated, and
Right.
you're going to be limited by your implementation based on the resources that you have, right? If there is a new program, like I think if there's a new policy or a new program that says like I'm making this up, but if every cancer
Mhm.
patient needs to have a nurse navigator, like that's going to mean that things have to change within the system, but that
Right.
may not be something that every health institution chooses to prioritize on their own. So that's why, like, that's another challenge with healthcare, right? Like, there's a lot of regulation, but it's also very state regulated. So, like, the way
Mhm.
that a hospital works in Missouri is going to be very different than the way one works in New
Yes.
York, um, for a number of reasons. And so, I think keeping that piece in mind, like that's probably where like outside the system can work a little bit more effectively. You're technically still within the broader system if we think
Yeah.
about like the Audre Lorde quote of like masters, can you build a master's house with a master's tools? I'm definitely butchering that, but basically I think my understanding of that quote is like, can you really build just effective equitable solutions within the system? And her answer is no,
Mhm.
which I completely understand and to a certain degree agree with. But then if you like, you can't completely be on the outside either because
Agreed.
that's not where all of the big decisions are being made.
Yeah.
So I think there has to be a balance of both, and I think it's okay to be radicalized one side or another. But the reality is both like inside and outside the system need to work together to actually make impact.
Yes, yes, absolutely. Oh, that you said that beautifully. And this is really an amazing moment for me because when you're on this journey, and we're all graduate students and we're getting these amazing prestigious opportunities. I think of course like we have a certain radical energy, to us.
Yeah.
Like we definitely have like, a vision for what we want healthcare to be and how we think it can better serve people. And then there's just a reality of like, oh, I also need to move up and I also have my career. And there's a part of this living in a capitalist society where it's like you have to kind of just be comfortable with, the tools at your disposal, so to speak. And
Yeah.
so if they are the master's tools, I would actually argue like the only way that we're gonna be able to, change anything is, with, kind of the same vehicle, the same kind of resources that got us here. And I have kind of seen myself grow from like starry-eyed dreamer at the beginning of my fellowship to really being able to contribute to some extremely impactful things in the racial equity space where I'm at right now. And I'm just
Mm,
like, wow, if I would have been too caught up in the idealism, right? If I would have read Healthcare of a Thousand Sites, probably like after the end of my fellowship, I'd have been like, "Yep, none of this is worth it. I'm done. Like, let's go. I'll start a nonprofit and do something else." I probably would not have had the experience or the exposure or even the know-how to
mm,
really do some of these things. Because another thing that I would love to get your thoughts on is I feel like this awareness that you have, that we share, is a generational kind of awareness, if if I'm not mistaken. I think that just
Yeah.
as we grow up in a technological age where information is so easily or readily accessible now, that you cannot not know about things, right? I mean,
Yeah.
it's Women's History Month, it's International Women's Day right now as we record this, and I feel
Right.
like even things like gender disparities in terms of pay, right? And
Yeah.
pay inequity. These are things like when I was younger, you may have heard about it, but like now it's at the forefront. Now organizations can't run from this. Like it's something that they have to address. And one thing that I want to do through your story and just like your contributions to healthcare already is inspire and motivate more people to be like you. Like that's like I'm being super serious. I am being super serious because I think that it's a delicate balance and dance between like working with folks and working with leaders that probably have nowhere near the lens that you have, and kind of getting them into a space where like they kind of come to the table and understand what we're talking about, but at the same time making sure that people that are coming after us feel just as bold and just as courageous, to be the next Anjanas, right? Because I feel like you even being an author and having a good position where you're at now, but not necessarily being a quote unquote leader, is really bold. I think it actually takes a lot of courage to be able to do that. What are the conversations like when it comes to things like health equity in your actual role? And how have you kind of learned to be effective as like a health equity champion, strategist, whatever you would call yourself?
Yeah, no, I think for me, it's been interesting because as I mentioned before, I work in cancer. And it's interesting to think about health disparities in the cancer space because I think in broader conversations, we often talk about health inequity or lack of access from a very primary care kind of perspective. So it's
Yes.
interesting to think about like, okay, this is like literally the most complex, specialized,
Mm-hmm.
expensive, devastating kind of care that folks need and who is
Mm,
able to access it and who isn't. So I think for me, I've been able to do my own sort of individualized research and like subscribe to the right podcast newsletters to kind
mhm,
of keep up with like what does health disparities look like in this specific space.
mhm,
But I think what's also really exciting is the institution I work for has created a health equity institute that we are trying to
mm,
do partner with and create QI meaning quality improvement projects around. And so like, for example, one of the projects that I'm working on that I spent a lot of my day working on today is improving access to colorectal cancer screenings.
okay.
And so it's like, okay, this is our catchment area, which these are the patients that we serve, or that see GI physicians within our network.
Mhm,
Which of these patients is has been seen but maybe hasn't had a screening and is
right.
eligible for one? And
Wow.
what is the racial background of that patient? Where do they
Mhm,
live within our network? What are the languages that they speak? Like, it's very
mm,
interesting to kind of do deeper dives into that data because it confirms what we already know to be true. But the
right.
most important piece is, okay, now that we have this data, what are we actually doing about it, and how do we actually design an appropriate, culturally appropriate intervention? Because a lot of times, like you and I well know, a lot of reasons for people to not engage with healthcare is because of institutional mistrust in
Yes.
healthcare systems. So it's like, okay, what are we doing to improve that? And what does that look like from a disease specific perspective, in this case cancer care?
Mhm,
So for me, I've been able to do a lot more health equity related work. And the reason I've been able to do that is because I think I appreciate you using the word courage. I've tried to be courageous about asking for that kind of work because
mm,
I know it's there and I know it's being worked
yes.
on.
Yes.
And so it's all about saying, like, this is something I'm really passionate about. And I know that, this is a challenge for marginalized communities in particular. Is there any way that I can support and I can help? The other piece of it is, of course, you need to have like a supportive manager who will say,
Mhm,
like, yes, I support this, and I want to make sure that you are getting the opportunity to gain meaningful skills and build strong relationships with others, but also work on the things that you want to work on. So for me, I think a lot of it is, yes, part of it is being courageous, but the other
mhm,
part of it is like, frankly, like having the stars aligned to say, like, okay, my manager supports me. She thinks I can do a good job with this. This is something I care about. A project is available and they need help.
Yes.
So it's definitely for me in my current role, it's been a nice mixture of all of those things coming together.
Yeah, I love that. Thank you for sharing that. It's very interesting. It's in this context of doing equity work or health equity work. I was pretty privileged being a part of the DEI team where I'm at.
Yeah.
So it's a lot easier for me to just that's my entire portfolio. But I meet so many young people of all walks of life, different races, generations, rural, urban folks who want to have their hands in this kind of work, right? And it's always interesting for me because, like you said, you knew that there are opportunities that are there, that are out there. And so for folks that are maybe aren't in even, more progressive spaces, like you said, it's about being courageous, but also kind of having the stars align.
Yeah.
And making sure you take the opportunity when you can. I want to ask a loaded question.
Let's do
So
it.
so it might not, be that great, but what is your ultimate vision for healthcare in the US or just in general? I just feel like, you are a history wonk, policy wonk, healthcare wonk, like you know so much. So I know you've had to like kind of sit there and dream. And if not, what is your ultimate vision? What are the things that you really want to see change and that
Mhm.
you want to be a part of as you kind of go out, throughout your career and end up being a hospital president one day?
That's very kind of you to say. I think for me, like before I even talk about my vision for healthcare, I feel like it's very challenging to talk about a vision for one particular industry because I think ultimately healthcare is a public good, right? Or should be. It's
Yes.
something that every person needs. It's not something that only a few people use and, not everyone actually needs. It's something like education, like
Mm,
water, like maybe not everybody uses public transit, but transportation infrastructure, like these
yes.
are all things that every single person needs. And if we focus, this vision, this question of a vision around the United States, what I would want to see is all of these different industries actively collaborating and working together to build
Mm,
the right systems that allow Americans to have unsurpassed quality of life.
mm,
And what I mean by that is like, can we ensure that every child gets a quality education and is able to play safely in a neighborhood and have access to green space and healthy, affordable groceries? And their parents have access to economic opportunities and the right healthcare benefits and getting appointments when they need. And when they get to those appointments, they're seen by providers that understand what they're going through, are able to prescribe and partner with them in a meaningful way as opposed to just, counting them as a number on a spreadsheet, like you said. I'm interested in building that future. And in
mm,
order to build that future, healthcare is just one slice.
right.
And I actually really have to credit my grad school experience for this because I chose to go to a public service school because all of my classmates, yes, I have healthcare classmates, but I also made friends with and took classes with people who really cared about things like economic
Ah,
empowerment, policy
okay.
advocacy, transit,
Interesting.
education. Like all of these things are interlinked, right? Whether we
Yes.
want them to be or not, they're all linked. So we can't, in my mind, you can't build this utopic world with a focus on one industry. You have to have
Hmm.
all of these different industries partner together because that's how we live our lives. Our lives are basically an integrated system of all of these industries, right? You wake
Hmm.
up in the morning and you turn your tap on and hopefully clean water comes out because that's the responsibility of waste management, right? You take the bus or your car to work and hopefully the roads are in good shape and the trains are working on time. You get
Yeah.
to work and the lights are on and they're functional, and that's because electricity is doing what it needs to be doing. So
Right.
like every single day we're interacting with all of these systems often simultaneously. So
Hmm.
for me it's like you can't just build a future where healthcare is what it needs to be. Everything needs to be where it needs to be. And I recognize that that's a very overwhelming vision to have. But
No.
I think it's possible because, like you said before, we have this generational awareness of there are all of these issues happening and they're all happening at the same time. But there needs to be a way that we all are able to come together with our individual expertise in whatever industry we're in and try to build that future together.
Yeah, no, you're absolutely right. It's very cool. I've never heard anyone kind of explain the benefit from pursuing an MPA. in healthcare in terms of like being able to bring all of those different perspectives together, like doing your graduate training, is very new to me. And it's funny because just because you know, I from like the public health perspective, you know, I
Mm-hmm.
often think more so about like what's my vision for healthcare in terms of health outcomes. And I've always
Of
thought like,
course.
well, that's
Right.
heavily integrated and dependent on way more than just the healthcare industry. I mean, there's so many other stakeholders in huge industries that have a big implications in health outcomes. And so it's nice just to see you kind of get the same you get to the same kind of like destination from the MPA
Yeah.
lens. If
Yeah.
only we could bring our MBA and MHA colleagues on board. No, I'm just joking. Not to talk about them. No, this has been a really, really refreshing conversation. You know, I'm just really thoroughly impressed, just kind of like by your discipline, your ability to kind of like take all of this. There's a phrase that I learned in grad school: health doesn't exist in a vacuum. And I feel
Mm,
like just through your work, literally like through your work, your healthcare of a thousand sites, but also like through your role now, I think you do a really great job at just coalescing all of that and kind of painting a very clear picture for people. So I am going to be hopeful that every person that listens to this, but particularly the future administrative fellows, the administrators, that they really take some inspiration from you and your story. Two questions just to kind of round us out here. The first, and you kind of already spoke to it, but what would be one charge that you would give to the next fellow, the next practitioner, professional, or anyone who is passionate about health equity and seeing things change? And the second question, where can people find you if they have questions or would like to connect with you to do more work or collaboration?
yeah. No, I appreciate that first question so much because I think a lot of people who start off as administrative fellows, they have, like you said, that like radical energy, that fire of like, I am in healthcare because I want to make things better and I want to make things more accessible. And I think you and I both know that sometimes we get to do very cool and exciting things as fellows, and sometimes you don't. And I think it's important to think about, where am I improving health equity in every project that I'm doing,
Mm,
right? So the way that I think about this is, when I was a fellow, this was at the height of the COVID pandemic. And
mhm.
one of our responsibilities was coordinating N95 mass distribution, which is
Ah,
a very unglamorous job, very
uh,
important job, but very unglamorous
yes.
job, right? So I would think like, oh, this is so time consuming. Like, I'm not getting to use critical thinking skills, whatever. But what am I actually doing? I'm actually helping protect our clinicians from getting sick, and I'm
Absolutely.
ensuring that they're able to deliver care to patients who, and if they, if these clinicians were ill, they wouldn't be able to deliver the appropriate care to patients. And if we don't have the right number of clinicians doing that, then our
Mhm,
patients will suffer.
mhm.
And you have a lot of patients, especially in the beginning of the pandemic, a lot of patients who had COVID initially were, highly acute patients, very comorbid. Oftentimes were patients who, were earning minimum wage, that sort of thing.
Yes.
So keeping that in the back of your mind, like, there is such a distance between, I'm responsible for coordinating mass distribution to that level of thinking, but I had to make that jump for myself to say,
Mm,
this is my contribution to health equity. So what I would say to those who are starting out their careers, whether they're administrative fellows, project coordinators, whatever the case may be, you aren't always going to get to do the fun, big, sexy stuff
yes. Yes.
to improve health equity, but you can find opportunities to improve health equity even in small ways, especially in the projects that you may get initially
Mhm.
when you start off your career. So that's my advice for future generations of healthcare leaders. And then to answer your second question, where people can find me, I'm on LinkedIn. I'm on Instagram at Anjana.Sreedhar01. I also have a Substack. It's called Healing Healthcare of a Thousand Slights, because I'm trying to take a more solutions oriented approach.
I love
A lot
that.
of people have told me the book is really great, but I kind of felt a little depressed after reading it. So I really want people to know, like, yes, our history is very heavy and fraught with all of the isms possible, but at the same
Mhm.
time, there are so many people using vehicles of technology, of policy, of, venture capital that are actually trying to make a difference and improve things. And so I'm trying to continue to write, but in a hopefully more hopeful way moving forward. And so that's some of the places that folks can find me.
That is excellent. Thank you so much, Anjana, for your time. This has been a great conversation. And I have been privileged to have you on the platform. So I really do appreciate you.
Yeah, no, thank you so much. And I also just have to say, like, shout out to you because I've been following you on LinkedIn for a long time. And it's very cool to see all of the amazing work that you've done with the podcast, with Brothers in Public Health, and how you're not just committed to telling people stories, but also lifting up other leaders who look like you. So I really just want to commend you for all of the work that you're doing in that space too.
Well, I appreciate you so much.
Of course.